When they told me I had breast cancer, I kept telling myself they've made a mistake. I was in such good health. How could I have breast cancer?
When I came to know that I have breast cancer, my whole world came crashing down. I thought I was near my death.
I was 29 years old, in a very good health, with no family history of cancer, and then I was told that I had breast cancer. It can happen to anyone at any age.
The bad news is that anybody can get breast cancer. The good news is that if detected early, it is fully curable. Hi everyone, welcome to our discussion on breast cancer. My name is Colonel Pant. I'm a breast radiologist. Let me introduce you to the other members of my panel. Dr. Mrs. Sareen, a renowned breast surgeon. We have Dr. Bhavna, who is a clinical oncologist with a special interest in breast cancer. We have charming Dipali, who is in her 40s, a lot like you. Sorry, Dipali, I revealed your age. She's most reluctant to get herself screened for breast cancer.
But Dr. Pant, where is the need? I've heard that breast cancer happens to only those people whose mothers or grandmothers suffered from it too. Nobody in my family has it, thank goodness. So why do I need to go for screening?
Family history is only one of the risk factors, Dipali. Age is another big risk factor. Women above the age of 50 are at a higher risk. In addition, if you had your children after the age of 30 or never had children, or if you haven't breastfed your children, your chances of getting breast cancer are higher. If you also started your periods before the age of 12, or if you had your period stopping after the age of 54, or if you have taken postmenopausal hormone, you are at a greater risk. Research has also shown a link between diet, physical inactivity, and obesity.
What is even more worrying is that most women who develop breast cancer do not have any of these risk factors. Many women who develop breast cancer would have no family history of breast cancer. In fact, no woman can ever be sure that she can never develop breast cancer.
But one thing is certain, that breast cancer is rising in India, especially in urban India. One study shows that 1 out of 25 women in their lifetime will develop breast cancer. As per WHO prediction, by 2020, India will catch up with their Western counterpart, wherein 1 in 8 women will develop a breast cancer in a lifetime, which is a very scary scene.
But let me stress the fact that early detection is the key to a possible cure. That is why we ask women above the age of 30 to get themselves screened regularly.
Well, maybe, but I only go to a doctor when there's something wrong with me.
At least we can ask you to do a breast self-examination.
A self-exam? How does one do it?
Let us show you through the clip.
Breast self-examination. Observing the breasts. First, stand in front of a mirror so that you can see at least up to your neck and down to your waist. Now, keeping your hands on your hips, look at the size and shape of each breast. If you notice any changes, you need to consult a doctor. But do remember that it is not unusual for one breast to be larger than the other. Look also for any puckering, dimpling, or any other changes in your skin. Now look at your nipples. Is there any change in the position of either nipple? Also, look for any retraction of the nipples or discharge from them. If you have large breasts, lift them up slightly to examine them underneath. Again, look for any changes in the skin here. Now raise your arms over your head and look for similar skin and nipple changes. Continue the examination with your hands clasped behind your neck, pressing them forward and tightening your chest muscles. Finally, place your hands on your hips, press down and in, and look again for any changes in your nipples and skin. Feeling the breasts. Lie down and place a folded towel under your shoulder on the side you're going to examine first. Raise your arm under which you have placed the towel. You may find it most comfortable to place your hand under your head. The area you will examine includes not only your breast, but also the area up to your collarbone, as well as below your breast, across to the breastbone, and over to your armpit. Using the pads of your first 3 fingers, begin to examine your breast using a series of small circular motions, each about the size of a rupee coin. You should use 3 levels of pressure: light, medium, and firm. This way, you can feel the different layers of breast tissue. Using this technique, trace a series of vertical strips moving from the collarbone to below the breast and back up again in zigzags until you cover the entire area. You may also use a technique where you trace a series of concentric circles towards your nipple, or a method where you cover the area through a series of wedges. Use the pattern that you're most comfortable with. But the most important thing is to cover the entire area of the breast. Also, squeeze the nipple gently and see if there is any discharge. If there is any discharge, please see your doctor. Now repeat the entire process on your other side by placing the folded towel under the opposite shoulder.
Okay, that didn't seem so difficult.
Not difficult at all, Dipali, but you need to know how to do it correctly and effectively. Get the feel of your normal breast and then look for abnormalities.
And if you find any change in the shape of your breast, any skin discoloration, any lump or thickening in your breast or underarm, or any changes in the shape of your nipple like puckering, retraction, or nipple discharge, you must see your doctor immediately.
Now, a self-exam needs to be done regularly after the age of 20. After the age of 30, in addition to this, you need to get a clinical breast examination done by a doctor.
Oh yes, my cousin said she gets a gynae to check her breasts.
Exactly, the doctor is more likely to pick up an abnormality if there's one.
So do I need both a self-exam and a clinical exam?
A self-exam once a month and a clinical exam once a year, that's all.
But after the age of 40, women have to be extra careful because with rising age, the risk increases.
That's right. That's when you need a regular mammogram.
Oh God, I've heard mammograms are really painful. A friend of mine was saying that your breast gets squashed so badly, it hurts horribly.
Did your friend say this after getting her mammogram done?
Well, no, she had also heard about it.
Well, Dipali, I get regular mammograms done and I can assure you it's painless.
Some women may feel little discomfort, but the thousands of women who have undergone mammography in my clinic never ever complained of pain, let alone acute pain.
It is advisable to get your mammogram done a few days after your periods.
So what happens in a mammogram?
Dipali, this is just an X-ray of the breast, which we do with the help of a specially designed machine to do that. A mammogram can pick up a tumor much before it can be felt. It also shows few deposition of calcium, which we use the word microcalcification, which is also indicator of early breast cancer. But these mammogram must be interpreted by a trained radiologist only.
That looks like a lot of radiation. Isn't that itself a cancer risk?
That's a complete myth. The risk from radiation is negligible.
Dipali, the studies have shown that all of us are exposed to background radiation, which is equivalent to 4 mammograms a year.
The benefits of an annual mammogram far outweigh the risks associated with it.
In some cases, mammography is not clear enough. That happens usually in a younger woman or women having a dense breast. In these cases, we also do an ultrasound.
And if a lump is found, it may require a biopsy. This is done by extracting a piece of tissue using a needle put into the lump. This is called a fine needle aspiration or a needle biopsy.
That needle procedure looked really painful.
It's only a needle prick, my dear, and it can save your life.
All these tests have only one aim: early detection.
You know, I feel so scared to get a mammogram done in case the doctor says I have cancer.
So you live in denial. That's not a sensible approach, Dipali.
Dipali, let me assure you that 9 out of 10 lumps are non-cancerous, but we have to make sure about it.
And even if the diagnosis is cancer, early detection and treatment can save your life.
You know, I've heard people say that cancer is painless, but the treatment kills you.
That's not correct. Why don't we ask some women who have had the first-hand experience of it all?
During chemotherapy, I had nausea, diarrhea, weakness. I also lost my hair. But it all passes. I got my hair back. This is my own hair. And the best thing is, I'm alive. I lead a normal life, a happy and a healthy life.
I was lucky. I went for my mammogram and my tumor was detected at a very early stage. I didn't need chemotherapy. My breast was saved and I was in the hospital just for 1 day.
My only regret is I did not do a self-examination or any form of screening. By the time I was diagnosed, it was late. I had to lose a breast. I had to go through chemotherapy and radiation. The doctor says, had I been diagnosed earlier, I could have saved the breast. I might not have had to go through chemotherapy or radiation. But look, I'm alive, happy, and enjoying my life.
I would like to spread a message that every woman should go for early screening.
As I said, due to late detection, I had to lose a breast. But that's not the end of the world. I went in for a breast reconstruction surgery. And believe me, after that, my body is absolutely normal the way it was earlier. I have a new breast.
Wow, these women are so brave. I thought breast cancer was a death sentence.
Absolutely not. Breast cancer is one of the most curable forms of cancer. Medical science has progressed hugely and research is ongoing to find out better ways to treat breast cancer.
And in early cases, which are diagnosed by a screening mammogram, and with the correct treatment, the cure rate is over 90%. And today, the treatment is quite patient-friendly. The patient needs to come to the hospital only for surgery, which also may not be in the form of a mastectomy. Chemotherapy and radiation are done as outpatient procedures. They come to the hospital, receive treatment, and go back home or go to work. And the best treatment is available right here in India.
Is there any way of reducing my chances of getting breast cancer?
You can reduce your risk by improving your lifestyle,
And how can I do that, doctor?
by maintaining a normal weight, eating a healthy diet, and regular exercise. Some risk factors are obesity, a diet rich in fats, and sitting around with no exercise. Junk food is definitely bad for you, even from the cancer perspective.
If possible, women should marry and have their babies before the age of 30. Today, a lot of women delay marriage as well as motherhood in order to pursue a career. It's quite possible to enjoy motherhood as well as a good career.
Research has shown that certain plant essences can help prevent or regress breast cancer. You can find them in carrots, yellow and orange fruit, tomatoes, watermelon, guava, green and black tea, cabbage, cauliflower, broccoli, flaxseed, and soya. Eat lots of fresh fruit and vegetable and exercise every day, my dear.
Well, Dr. Pant, I will do the self-exam, go for the clinical exam and mammogram. That lady said she wished her cancer had been detected early, then she would have been spared so much of pain. That really makes me think.
Remember, breast self-examination once a month after the age of 20, clinical examination once a year after the age of 30, mammogram once in 2 years after the age of 40, and once a year after the age of 50.
And then you can hope to live up to 90.
I'm so glad we had this discussion. Early detection is now my mantra, and I'm going to spread this mantra to my women friends and family members.
Excellent. Let me do a quick recap. Breast self-examination, clinical examination, and mammogram. Please remember, even if you don't have those known risk factors, you can still contract this disease.
And maintain your normal weight, eat lots of fresh fruits and vegetables, and exercise daily.
Talk about it. Don't feel shy.
And that's how together we can beat breast cancer.
I went through the intensive treatment, but as you can see, I'm leading a healthy and a happier life today.